106.3 Life FM. It's the News Boys. I'm Matt Pelishek.
I'm Aaron Perlman.
This is the Afternoon
Joyride.
So, all over social media, and maybe even you've seen just through TV, media sources, whatever, we have this thing with masks going on right now, right? There's the guidelines. We have to have masks. Stores are requiring it and all of these things. But there's a lot of different information out there about why we should, or people that think why we shouldn't, and just so much info.
Stats come out, numbers. There was one we had on TV the other day, 65% of the chance of getting COVID-19 is because you didn't wear a mask. So masks are important, or are they not? So we wanted to bring in a doctor to kind of talk all about it. Dr. Benjamin Ha over at Kaiser Permanente. Thanks for coming on.
Thanks, gentlemen. Thanks for having me.
Well, it's good to have you because for us, I think there's just so much information. Sometimes it's hard to sort through, like what is, what isn't. You know, when all of a sudden everyone on Facebook seems to have become a respiratory expert and then that kind of thing. So we wanted to start just kind of lay out from the very basics, like the whole idea of masks. Why is it there? Maybe explain to us, like, why is masks the thing?
Oh, absolutely. So, when we talk about masks, I think we need to first start by making sure we have a common understanding around COVID and how it is transmitted. So I think we would all agree that COVID-19 is real, that it's a virus that can be passed from person to person, which is the way you typically get infected. And the primary way of getting infected is through exposure to the virus through your nose and through your mouth. Now, whether that's through interacting with someone who has it, or perhaps touching a surface and having your hands infected and self-infecting by rubbing your nose or rubbing your eyes. So I think if we come to an agreement that COVID is passed from person to person, and we also agree that the primary point of entry is your nose and your mouth, then I think we can now discuss why would a mask be helpful in potentially reducing your risk of infection. So if two people are standing next to each other and neither one has a mask, there's a very high likelihood that they're kind of sharing the air between them, potentially breathing in the same air. Whereas if both people were wearing masks, the mask creates a barrier so that potentially the breath that you're putting out there is not being inhaled by the person in front of you. And masks are designed to do that. They're designed to help filter the air that you're both breathing in and breathing out, which is why wearing a mask not only protects yourself, but also potentially protects the person you're interacting with in case you might be infected and don't know it.
Now, I feel like we've seen this a lot before as your doctor. Doctors give surgeries, or even if it wasn't a surgery, it would be something else, and they would come in and inspect you. You do the same thing with your patients. So it's common for us to see doctors. Is that the purpose when you guys do that on a surgery? Is it the same reason to protect us?
Yeah, correct. So surgeons who go into the operating room every day, they are required to wear a mask before they set foot into the operating room, and that is to help keep the field sterile. Meaning we don't want to be introducing bacteria or viruses into the operating field and potentially passing those off to the patient. And surgeons who do very complex surgeries wear masks for hours on end, and have no negative effects in doing so, and it doesn't impair their ability to perform very high-level surgery. So, I mean, if you are someone who needs an operation, you really do want your surgeon wearing a mask at all times to keep the area as sterile as possible and reduce the risk of spreading infection.
Well, I think that kind of maybe answers one of the things I wanted to ask, because an objection that I've run into or concern from some people is that, well, does, wearing a mask somehow, trap the carbon dioxide or somehow make it, less safe to breathe. But I would imagine with surgeons that have to wear a mask for hours on end, that would not be the case. Is that correct?
Correct. They're wearing the same type of mask you might receive if you entered a medical facility, so surgical masks. And masks are not designed to completely block air from passing in and out of your respiratory system. They are there to filter the air and reduce the risk of spread of bacteria and viruses. So unless you're even the surgical or the medical masks that we wear in the ICUs, the N95s, which are for the highest filtration masks, even those do not completely prevent air from coming in and out of the mask. They are simply designed to filter a much higher percentage of particles that may be passing through. And this would be the same if you were working construction. That you would want to wear one of those masks to help prevent yourself from inhaling dust or other particles. It's the same idea.
Mm. I was curious, just a little bit off of mask for just a second. There has been a lot of rise of cases of COVID in Kern County of late. What do you think is the cause that is sparking that? Is it because of masks, or is it just people just more interacting with each other?
I think it's obviously multifactorial, but number one, when not every single person in the community wears a mask, the risk of transmission does go up. Because all it takes is one person to be in a group setting or an environment where they're passing it off to other people, maybe even unknowingly. They may not feel sick, but they could actually be infectious, and they could be passing to other people. And then number two, I think as the restrictions were loosened, after spending so many weeks at home, people were ready to spend time with their family and their friends and their community, and that's just human nature. We want to be around others, but in doing so, we created more opportunities for the virus to be passed between people. So both of those factors, I think, have come into play. I do think the dramatic rise we've seen in cases recently is very concerning in terms of our capacity at the hospitals and even the opportunity to loosen restrictions in the future. So I'm hopeful, if we all do our part and try to minimize getting together in large groups, as well as always wearing a mask when in public, those two things would go a long way to reduce the spread of COVID-19.
I think that's really good. That helps, I think, make it a simple way to understand. One of the reasons we wanted Dr. Ha to be on with us also is he has just such this gentle spirit about him. Dr. Ha is not one of these guys that gets real militant about this or that or political or anything. Just a guy that is really smart when it comes to medicine and health. So is there anything that, I don't know, maybe common misconceptions that you run into with patients or anything like that you think are important to address as any of this is concerned?
Well, I think the place I would start is really how to wear a mask properly. Even in my medical office, I see a lot of people wearing it just over their mouth. You have to remember, if you're not covering your nose and you're breathing in and out through your nose, you're breathing in air that potentially could be infected with COVID. Mm-hmm. And you're minimizing the protection the mask provides you by not wearing it consistently over your nose and your mouth. And I do understand there are people who have serious medical issues, COPD, asthma, and other issues that does make it very difficult for them to wear masks for prolonged periods of time. I would also say if you have those conditions, you are also very high risk if you were to become infected. So you should be doing everything possible to try and reduce your risk of exposure.
Does it matter which kind of mask you wear? A bandana, a scarf, or just like the N95s?
I think there is evidence that the surgical mask is a higher quality mask, perhaps the better in terms of filtering out the particles of viruses. But really, any face covering that you can wear, whether it's a homemade mask, a bandana, a neck gaiter, all of those are reasonable options. The biggest thing is just trying not to bring air into your body that potentially is infected with COVID. That's how we're getting infected. People in close proximity, perhaps in an enclosed setting, a room, someplace where air is not circulating well, and you may have one person in that room who's infected, doesn't know it, not wearing a mask, and they're just putting virus out into the air constantly every time they breathe in and out. And that's why we see these super spreader events where one person is enough to infect multiple people, to then infect multiple people. So anything you can do to protect yourself by covering your nose, your mouth, staying away from very enclosed settings with lots of people, so those two things would help a lot reduce the spread of COVID-19.
That is super helpful. I think you've helped us understand a lot. We're just about out of time, but I forgot there was one other question I wanted to ask because I see it pop up, and that is, could you maybe help us understand the difference? I've heard the comparison to the flu. I'm sure you've heard this too, about how, COVID is basically just like the flu in terms of its spreading and it's just going to happen. Can you help us understand that or maybe the difference and why this is such a big deal comparatively?
Right. So from my understanding, COVID and the flu they're two different viruses.
Yeah.
They're not one and the same. The interesting thing with the flu is the time from infection to symptoms is much shorter. And unless you get infected with the flu, you're not going to be carrying the flu around for 2 weeks or a week before you present with symptoms. It's going to be a much faster onset of symptoms, which is why someone who gets infected with the flu, you see them and you kind of know. The danger with COVID is you can become infected but remain asymptomatic for a week, even up to 10 days or 2 weeks, where you're infected but you really don't know it because you don't have any symptoms. And that's where the danger comes in. Someone who has COVID doesn't realize it, feels fine, yet is actually out there in the community spreading it potentially to other people. So the rate of infection for COVID is so much higher than it would be for the flu. So the number of people that one person with COVID might infect is much higher than the number of people that someone with the flu might infect. And because in the past, most of us have seen the flu in some form, whether through vaccine or through your own illness, that your body may have some already built-in defense against the flu, whereas COVID right now, this particular strain of COVID, humans have never seen before. So our immune systems have no memory of this virus or have no immediate defense against this virus. And that's where some people can get very sick very quickly. I think that the last thing is, in a lot of ways, what I'm hearing right now is everyone's getting exposed because more and more people are coming down with COVID. You know somebody, you were exposed to somebody, and you don't know if you should be tested or what your risk is. And it's really confusing because, again, you can be infected and not even know it. So if you were exposed to someone who was sick or who may have had it, and you think you may have been infected, you really need to do your best to stay home, self-quarantine as best you can. And if you develop symptoms, contact your healthcare professional to talk about getting tested. Because once you know for sure whether or not you have it or not, that will help you to know whether it's safe for you to get back into the community.
I do want to ask just a quick follow-up.
Yeah,
if you get tested, say you go get tested, you were near somebody, you're near somebody who has it. You go get tested. Is it possible to come back negative, and yet all of a sudden, because it takes a while for it to form, that you would then show up 3 days later?
It is a possibility. So let's say someone calls me and says they have symptoms of COVID, fever, body ache, cough, etc., and we test them and they're negative. I still have a very high suspicion that you may have COVID, because there is a chance that when we do the swab, at that moment in time, there simply isn't enough viral particles within your nasal passages for us to pick up the virus. There has to be a certain amount present when we test you to actually pick it up. So there is always a chance that we test you and you actually test negative, but you are still infected. So if you have any symptoms, a fever, a cough, runny nose, sore throat, and you think you have COVID, even if you test negative, you should still take precautions to wear a mask, to limit your activity out in public, to not go to work, potentially infecting others. And there may be a point at which you actually need to be retested as your symptoms progress. So no test is perfect. The COVID test by no means is perfect. It really depends on how long you've been infected, how much viral particle is within your nose, your nasal passages when we test you. And there is always a risk of you getting a false negative. But I've seen multiple fold numbers of positives coming through. Initially, when this outbreak started, because we were social distancing and staying home, the rise in cases was quite low. But recently, the number of cases have really taken off, and it's quite concerning.
Well, we really appreciate you helping us kind of walk through. That gives us, I think, a much better, much more simple way to understand this, understanding the importance of masks, the whys, all of those questions. So this has been really helpful, Dr. Ha. I appreciate you taking the time to be with us today.
You're very welcome. Thank you so much for the opportunity.
Country Christian School is proud to partner with 88.3 Live FM.